Diabetic ketoacidosis (DKA) and hyperosmolar hyperglycemic state (HHS). Most nursing students mix this up, but it is actually much more simpler than you think. They have similar signs and symptoms, but they are both emergencies. So why are they completely different? Let's start with diabetic ketoacidosis (DKA). In DKA, there is absolutely no insulin. Zero. There is nothing. There's no insulin at all. Now, when there is no insulin, that means glucose cannot enter the cells because insulin is like the key that opens this door for glucose to enter the cells, and the cells need glucose to convert to energy. Now, in DKA, there is no insulin at all. Therefore, the body and the cells are unable to get glucose to use for energy. So they will now switch to breaking down fat so that they can get energy. Unfortunately for the body, this fat breakdown leads to a byproduct called ketones. As the body breaks down fat to use for energy, ketones are being produced as a byproduct. Ketones is an acid. Continuous breakdown of fat, because the body continues to do this in order to get energy, it leads to a buildup of ketones, and therefore the body becomes acidic. Remember, ketones is an acid, and it continues being produced, the body becomes acidic. That is basically what it means. So in diabetic ketoacidosis, there is fat breakdown leading to a byproduct or production of ketones. Accumulation of ketones leads to acidosis, which is why it is called diabetic ketoacidosis, because this acidosis is caused by the presence of ketones. Is that understandable? Remember when we talked about the pathophysiology or disease process of diabetes mellitus? If you've not watched that video, please go and watch it. You would find it very helpful in understanding this particular video as well. Remember we said when glucose is unable to enter the cells, it accumulates in the blood. Accumulation of glucose in the blood leads to hyperglycaemia, which is basically excess glucose or sugar in the blood. It spills into the urine. Spilling into the urine is that it draws water. As it draws water, there is polyuria, which is excessive urination, leading to the body getting dehydrated. These two features are also present in the complication, which is in diabetic ketoacidosis. So there is hyperglycemia, there is dehydration, there is ketones production, and there is acidosis. From what we've just said, what do you think are the features of diabetic ketoacidosis? First of all, there will be hyperglycemia because the glucose is unable to enter the cells. Now, in an attempt to try and get energy, since there is no glucose, the body switches to fat metabolism. It breaks down fat. As it's breaking down this fat, it produces ketones. Excessive accumulation of ketones will lead to acidosis. And remember that diabetic ketoacidosis only happens when there is no insulin at all. There is nothing to actually help for glucose to enter the cells. And therefore, the type of diabetes that is normally associated with diabetic ketoacidosis is type 1 diabetes. Because in type 1 diabetes, there is no insulin production at all. You will see patients who suffer from type 1 diabetes, they are the one who have to take insulin shots, usually every day, at least once a day, or sometimes 3 times a day, depending on what they are prescribed for, because they don't have any insulin production at all. Now let's compare it with hyperosmolar hyperglycemic state. In this one, there is some insulin present. In HHS, there is some insulin present. Remember that in DKA, there is no insulin at all. In HHS, there is a small amount of insulin present. And this small amount is just enough to stop fat breakdown. So it will prevent the body from switching to fat metabolism, which means there is no ketones being produced because fat is not being broken down, so no ketones are being produced. But this small insulin is not enough to control blood sugar. It's not enough for blood sugar or blood glucose to move into the cells. Therefore, the blood sugar or the blood glucose continues getting higher because glucose is continuously accumulating in the blood, because the insulin available is not enough to move it into the cells. So it continues to just be in the blood and build up, leading to very high or extreme hyperglycemia. The amount of hyperglycemia in HHS is extremely high. It is higher than in DKA. It is very, very, very high. And in extreme hyperglycemia, which means the blood sugar is very, very high, what do you think would happen to the other symptoms? It means there will be severe dehydration because the blood sugar is so high. It is so high, which means the amount of sugar spilling into the urine will also be a lot more higher. If it's a lot more higher, the body will pull more water to try and dilute or to balance the concentration of the urine. Because it's so much, it's just pulling so much water, leading to severe dehydration. Remember to watch the video on the disease process of diabetes mellitus. It is the video before this one. It's a 10 minutes video and you will understand. It will help you to understand this better. So there is now extreme hyperglycemia. There is severe dehydration, but there is no fat breakdown, which means there is no ketones being produced in HHS, and there is no acidosis. Because there is no ketones, therefore there is no acidosis. This is the major difference between the two. In HHS, there is no ketones or acidosis, but in DKA, there is ketones production, therefore acidosis. In HHS, there is extreme hyperglycemia, but in DKA, there is hyperglycemia, but it's not as high. It's not as high as in HHS. In DKA, there is also dehydration, but because the hyperglycemia is not extreme, it means that in HHS, there is extreme or severe dehydration, because that is what follows extreme hyperglycemia. And because in HHS, there is some insulin present, it is most commonly seen as a complication of type 2 diabetes mellitus. Because in type 2 diabetes mellitus, there is some insulin present, but the cells are resistant to it. So it is mostly associated with type 2 diabetes. The easiest way to remember this is to think DKA, diabetic ketoacidosis, there is ketones and acidosis. HHS, hyperosmolar hyperglycemic state, there is high blood sugar, extremely high blood sugar, but no ketones. If you remember just this table, you will never confuse them again. So can you tell the difference between the two of them now? If you're confused about type 1 and type 2 diabetes, well, you're in luck. That will be the next video.